Which of the following is high potency antipsychotic drug having minimal sedative and autonomic effects and no propensity to cause weight gain? That is haloperidol. Clozapine is considered to be an atypical neuroleptic because it has weak antidopaminergic action but high antipsychotic efficacy, and its side effect profile is different from that of chlorpromazine. The following side effect of typical neuroleptics may respond to propranolol, that is akathisia. Which of the following is an atypical neuroleptic drug? That is olanzapine. Olanzapine has the following features except it produces prominent extrapyramidal side effects. It has an antipsychotic drug with weak D2 receptor blocking action. It has potent PH5HD2 blocking and antimuscarinic actions. It lowers seizure threshold. What is true of risperidone? It is an atypical neuroleptic which produces few extrapyramidal side effects. It has combined dopamine D2 and 5-HT2 receptor blocking activity. The following antipsychotic drug has weak dopamine D2 but additional 5-HT2 blocking activity and benefits both positive and negative symptoms of schizophrenia. That is clozapine. The following drug is not likely to produce dependence. That is chlorpromazine. Which of the following is the long-acting neuroleptic having specific antidopaminergic action but little adrenergic or cholinergic blocking activity? That is pimozide. The major limitation in the use of clozapine for treatment of schizophrenia is its potential to cause agranulocytosis. Selective inhibition of conditioned avoidance response in animals by a drug indicates that the drug is likely to be effective in schizophrenia. The following action of chlorpromazine is not based on its antidopaminergic property, that is hypotensive. Chlorpromazine therapy increases the secretion of the following hormone, that is prolactin. Compared to other antipsychotic drugs, the distinctive feature of penfluridol is very long duration of action. Which of the following adverse effects of neuroleptic drugs is positively correlated to the antipsychotic potency of the different compounds? That is extrapyramidal motor disturbances. Actions of chlorpromazine include the following except hypoprolactinemia. Chlorpromazine shows indifference to external stimuli, postural hypotension, hypothermia in cold surroundings. Flufenazine differs from chlorpromazine in the following respects except it has higher antipsychotic efficacy, it is less sedative, it is less likely to precipitate seizures in epileptics, and it causes more prominent extrapyramidal side effects. The neuroleptic syndrome produced by chlorpromazine-like drugs is characterized by the following except ataxia. The distinctive action of chlorpromazine-like drugs not possessed by any other class of drugs is correction of distortions of thought and perception occurring in psychosis. Select the drug that reversibly inhibits the enzyme COMT and is useful as an adjunct medication in advanced Parkinson's disease. That is entacapone. The following drug is effective in chlorpromazine-induced Parkinsonism. That is trihexyphenidyl. The anti-Parkinsonism-like action of central anticholinergics has the following features except they are the preferred drugs in advanced cases. They control tremor more than rigidity. They produce a low ceiling therapeutic effect. They are effective in neuroleptic drug-induced Parkinsonism. The following category of drugs is not indicated in early or mild cases of Parkinson's disease. That is COMT inhibitor. For majority of patients of Parkinsonism, the standard drug therapy is it's a combination of levodopa plus carbidopa. Entacapone differs from lactolcapone in the following respects: that it is short acting, it acts only by inhibiting peripheral metabolism of levodopa, it is not hepatotoxic. The following is true about entacapone except it acts by inhibiting degradation of dopamine in the brain, so it can accentuate levodopa induced dyskinesias. It prolongs the therapeutic effect of levodopa carbidopa in Parkinsonism. Which of the following drug has mild anti-Parkinsonism action of its own, prolongs levodopa action and allows reduction of its dose by about 25%? That is selegiline. The primary action by which entacapone and tolcapone enhance the therapeutic effect of levodopa and carbidopa in Parkinsonism is inhibition of levodopa methylation in the liver. The following drug is added to levodopa therapy of Parkinsonism to attenuate wearing off effect. That is selegiline. The following is true of selegiline: that at doses used in Parkinsonism, it does not interfere with peripheral metabolism of dietary amines. The following drug combination should not be used in Parkinsonism: that is a combination of amantadine and anticholinergics. The anti-Parkinsonism drug which acts by inhibiting the degradation of dopamine in the brain is selegiline. Tolerance to the anti-Parkinsonism action develops most rapidly in the case of amantadine. Select the anti-Parkinsonism drug which directly activates dopaminergic D2 receptor in the striatum. That is pramipexole. Ropinirole differs from bromocriptine in the following respect: that ropinirole produces milder GI side effects, and in early cases of Parkinsonism it is less likely to need levodopa supplementation. Though bromocriptine acts directly on dopamine receptor, it is used in Parkinsonism only as a supplement to levodopa because used alone, its effective doses produces intolerable side effects. In the treatment of Parkinsonism, bromocriptine differs from levodopa in the following respects except it does not produce behavioral or psychiatric side effect. But it does not need conversion to an active metabolite. It has a longer duration of action. It activates dopamine D2 receptor with little or antagonistic action on D1 receptors. Use of carbidopa along with levodopa in the treatment of Parkinsonism minimizes on-off effect. The following adverse effect of levodopa is not minimized by combining it with carbidopa, that is involuntary movements. Loss or alteration of taste sensation can occur as a side effect of levodopa captopril penicillamine. Which of the following adverse effects of levodopa has a delayed onset and increases in severity with continued therapy? That is abnormal movements. The drug which abolishes the therapeutic effect of levodopa in Parkinsonism but not that of levodopa carbidopa combination is pyridoxine. The usual cardiovascular effect of levodopa is fall in blood pressure due to decrease in sympathetic tone. The following drug or drugs does or do not produce any overt CNS effect in normal individuals but exert a clear cut therapeutic effect at the same dose in the presence of a specific neurological or psychiatric disorder. that is levodopa. The most effective drug in Parkinsonism is a combination of levodopa plus carbidopa. In Parkinsonism patients, levodopa exerts the following effects except reduces skeletal muscle contractility. It decreases muscle tone, increases locomotor activity, and inhibits muscle tremor. The dopamine D2 receptor has the following feature. It is negatively coupled to adenyl cyclase. A 3-year-old boy gets seizures whenever he develops fever, which is the most appropriate strategy to that he does not develop febrile convulsions. So, intermittent diazepam prophylaxis started at the onset of fever. The preferred drug for status epilepticus is IV diazepam. Risk of neural tube defect in the offspring can be minimized in pregnant women receiving anti-epileptic drug by supplemental therapy with folic acid. Which of the following is the most suitable drug for a 6-year-old girl suffering from absence seizure with occasional generalized tonic-clonic seizures? That is sodium valproate. Select the factor which indicates that withdrawal of the successfully used antiepileptic medication is likely to result in recurrence of seizures. That is partial seizures. An epileptic woman controlled by phenytoin therapy conceives. Which of the following measures is most appropriate? That gradually reduce phenytoin dose to the lowest effective dose or level. The following is true in the treatment of epilepsy except the choice of drug depends on the cause of epilepsy and not on the seizure type. The correct statement about epilepsies are: this treatment should be instituted as early as possible. Treatment is generally started with a single drug and the other drug is added or substituted according to response. Withdrawal of drug can be attempted if no seizures have occurred for 3 to 5 years. A combination of two or more anti-epileptic drugs is used only when monotherapy with first or second choice drugs fails. Gabapentin acts by enhancing GABA release. Select the anticonvulsant drug that acts as a GABA transaminase inhibitor, that is vigabatrin. The following is true of topiramate except. So the true statements are: it is a broad spectrum anti-epileptic drug. It inhibits the enzyme carbonic anhydrase. It is used as or add-on therapy in refractory partial seizures. But the incorrect statement about topiramate is: it is not effective in generalized tonic-clonic seizures.